Okay, so today we're going deep, really deep, into something that, well, frankly, kind of gives me the chills just thinking about it. We're talking humerus fractures, broken upper arm bones, and more specifically, all the things that can go wrong after you break one. We've got this medical text here, super detailed, outlining all the potential complications, and let me tell you, it's a bit of a wild ride.
Yeah, it's interesting, right? Humerus fractures, they're more common than you'd think. And while most folks bounce back just fine, knowing what could go wrong, well, that's important stuff, whether you're the patient or heck, even the doctor treating them.
No kidding.
Mhm.
And this text wastes no time getting to the heavy stuff, like right off the bat, bam, compartment syndrome, even go so far as to call it a surgical emergency. I mean, yikes. What makes this complication so serious?
So picture this. You've got your muscles, right? And they're all wrapped up in these tough, kind of fibrous compartments. Now, when you break a bone, like the humerus, there's going to be swelling. But if that swelling gets trapped inside one of those compartments, the pressure builds up. And it's
Uh,
bad news.
Oh, I bet.
Because that pressure, it starts squeezing off the blood vessels. No blood flow means no oxygen getting to the muscles and nerves in there. And if you don't relieve that pressure fast,
Yeah, it doesn't sound good.
it can lead to some serious damage, like permanent tissue damage. You could even lose function in that limb. That's why we call it a surgical emergency. You got to go in and cut open those compartments to release that pressure, like ASAP.
Okay, that is intense. And speaking of things that make me nervous, the text also mentions nerve damage, particularly to the radial nerve, which I guess can cause something called wrist drop. Can you break that down for us a bit? Like, what exactly does the radial nerve do, and how does breaking your humerus mess with it?
All right, so the radial nerve, think of it as the control center for your wrist and hand, especially when it comes to extending them, lifting your wrist up, straightening your fingers.
Okay, got it.
Now, when you have a fracture in the middle of the humerus, right around where that radial nerve runs, well, sometimes that nerve gets pinched or even torn during the break. And boom, you've got wrist drop. You can't lift your wrist anymore. Simple things, picking up a cup, turning a key, forget it.
Wow, that sounds so debilitating.
It can be, yeah. But the good news is the earlier you catch it and intervene, the better the chances of getting that function back. Surgery can often decompress the nerve, and there's even some promising new techniques for nerve regeneration and grafting.
That's reassuring to hear. Okay, so moving on to some of the shorter-term complications, the text really emphasizes the risk of infection, especially with, and I quote, open fractures. Can you explain what that means? Like, what's the difference between an open fracture and just a regular fracture?
Sure, an open fracture. Well, it's exactly what it sounds like, right? The bone actually breaks through the skin. So now you've got this open wound exposed to all kinds of nasty stuff from the outside world.
Oh, yeah.
Yeah, and that creates a direct route for bacteria to get in and set up shop. Infection risk goes way up. Closed fracture, on the other hand, means the bone's broken, but that skin is still intact, doing its job as a barrier.
So with an open fracture, you're basically fighting a war on two fronts, the break itself and potential infection.
Exactly. That's why treatment for open fractures is so aggressive. You got to clean that wound out thoroughly, debride it, hit it with some powerful IV antibiotics, and often you'll need surgery to stabilize the fracture A and D close that wound up tight.
Wow, it's amazing how much more complicated just that one difference makes.
Absolutely.
Okay, so the text also throws around some terms that honestly sound a little terrifying.
Mm.
Non-union, delayed union, malunion. Can you translate those for us? Like, what do they actually mean for someone trying to recover from a fracture?
All right. Well, imagine your bone is like a bridge that's under construction. In a perfect world, the two broken ends, they line up perfectly and fuse back together, strong and stable. But sometimes, well, the construction crew runs into problems. So, non-union, that's like a bridge that never gets finished. The two ends, they just don't join up. You're left with this gap that never heals properly. Could be because of poor blood supply to the area, maybe an infection got in the way.
Oh, I see.
Then you've got delayed union, which is more like the bridge is being built, but it's going at a snail's pace. Healing takes way longer than it should, which means more pain, less mobility, all that fun stuff.
Right.
And finally, malunion. That's when the bridge gets built, but it's kind of wonky, maybe it's crooked, maybe the pieces didn't line up quite right, so it heals, but it's not quite right. Could affect how well that limb works in the long run.
Ouch. So with all these unions, but what's the fix?
Well, depends on the case, of course.
Yeah.
But you might be looking at more surgery, maybe some bone grafting to help things along, or special braces to kind of coax those bones into healing the right way.
Okay, those analogies really help. Thanks for that.
Yeah.
So shifting gears a bit to the long-term consequences of humerus fractures, the text mentions stiffness and reduced range of motion, especially in the shoulder. How common is this, and is it something that people can actually recover from?
Yeah, so some stiffness, that's pretty much par for the course after any fracture, especially if it involves a joint like the shoulder. But the good news is it doesn't have to be a life sentence. Early and consistent physiotherapy, that's your key weapon in this fight.
Physiotherapy.
Think of it like this. Your shoulder's a hinge. If you don't move it regularly, it gets rusty, stiff, hard to use. Physiotherapy is all about keeping that hinge lubricated and moving smoothly. The exact exercises, they'll depend on the fracture in the person, but the goal is always the same. Get that mobility back as much as possible.
That makes sense. So staying on this track of long-term issues, the text also brings up post-traumatic arthritis. Like, how can breaking a bone lead to arthritis years later?
Okay, imagine the cartilage that lines your shoulder joint. In a healthy joint, it's smooth, like a perfectly polished dance floor, allowing the bones to glide over each other effortlessly. But when you have a fracture, that smooth surface gets disrupted. It's like someone took a jackhammer to our dance floor.
No.
Yeah, now you've got rough patches, uneven spots. That creates friction, wear, and tear on the cartilage. Over time, that damage can lead to post-traumatic arthritis, and this risk, it's even higher in fractures that actually involve the joint surface itself.
I see.
Like if the fracture extends into the ball and socket joint of the shoulder, well, that's direct damage to the cartilage, making arthritis much more likely down the road.
Yeah, that's rough. Okay, so last but definitely not least, the final complication listed in the text is this thing called complex regional pain syndrome, or CRPS. What can you tell us about that? It sounds intense.
It can be, yeah. CRPS, it's a tricky one. It's like your body's pain alarm system goes haywire, stuck on high alert, even after the injury itself has healed. So you've got this constant, often burning pain in the affected limb, super sensitive to touch, maybe even changes in skin color or temperature. Sometimes you get muscle weakness and stiffness too. It's a whole cascade of neurological and inflammatory responses, and honestly, we're still not 100% sure what causes it.
So how do you even treat something like that if you don't fully understand it?
Well, early diagnosis and a multidisciplinary approach are key. We're talking pain meds, physical therapy, occupational therapy, even psychological support to help people cope with the chronic pain and hopefully regain some function. It's a tough condition, no doubt about it.
Definitely sounds like it.
Huh.
Okay, so taking a step back, the text outlines several different management strategies for all these complications. It mentions early diagnosis through imaging, surgical and non-surgical options like casting and bracing, and then of course there's rehabilitation with physical and occupational therapy.
Exactly. And it's important to remember, every case is different. The specific approach is going to depend on the person, the fracture, all sorts of factors. That's why ongoing monitoring, those follow-up appointments, they're so crucial. Got to make sure the bone's healing right, catch any potential problems early, and adjust the treatment plan as needed. It's a team effort, the patient and their healthcare providers working together.
Well, this has been a truly eye-opening deep dive. Maybe eye-opening isn't quite the right phrase when we're talking about all these potential complications.
Yeah, maybe not.
But I think our listeners are walking away with a much better understanding of what can happen after a humerus fracture.
Absolutely. And I just want to emphasize, this is all general information. Every case is unique, so talking to your doctor, getting personalized advice, that's non-negotiable.
So true. And here's one last thing for our listeners to ponder as we wrap up. We talked a lot about the physical stuff, but what about the mental and emotional impact of an injury like this? The pain, the limitations, the uncertainty about the future, those can take a toll. It's something to think about, something to consider as we navigate the complexities of healing and recovery.
Couldn't agree more.
Thanks for joining us on this deep dive, everyone.
Thanks for having me.
You've been listening to the Learning Podcast, a production of Metanesta. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.